Thank you so much for being with us today, Dr. Kofi. It would be so great for you to give a quick introduction to our audience.
Awesome, awesome. Thank you all for having me. My name is Dr. Kofi Essel. I'm a community pediatrician by training, and I'm the Food as Medicine Program Director at Elevance Health.
Awesome. Thank you again so much for your time today and taking out of your busy schedule. As we know, March is National Nutrition Month. So I wanted to ask you if you could share your journey as a pediatrician and how your focus on nutrition evolved in your career, particularly with the focus on pediatric patients.
Great question. So it's interesting, when I started doing work in this space, I've always been interested in food and nutrition. And when I got to medical school, I always thought I would have to put my interest in food and nutrition to the side. Why? Because doctors don't really do work in food and nutrition. That's what I was always told. Well, I looked at the research and it was clear. There was not a big emphasis on food and nutrition in medical training. Years ago, 1985, groundbreaking report from the National Academy said, hey, we need to incorporate more nutrition education into medical training. And years later, we learned that it still hasn't been done. So this was something that we had to kind of go out and seek after, finding opportunities and mentors who are focused in food and nutrition space. And I had to really sit under them and learn from them how I could then incorporate this into medicine. Years later, as I chose to go down a track in pediatrics, I started to really enjoy this space and try to figure out what the best lane is for me to take this career path. And initially, when you started to see work done in this space around food and nutrition in children in particular, everything was focused on obesity, right? Obesity prevention, obesity management, obesity solutions. And this
Mm.
was an important aspect, but it didn't tell the whole story. Why is that? Well, obesity is far more complex than I had been led to believe years ago, right? Obesity is a complex, multi-system chronic disease that requires a multidisciplinary approach. The simplistic approaches that we were using with calories in versus out were not really addressing the condition and wasn't really meeting families where they were and recognizing the incredible stigma we were bringing into the care of our patients and families. What happened through my journey was I started to learn a lot about what I would call social drivers of health or health related social needs, especially around food and nutrition. And one of these social drivers of health that I started to learn a lot about was food insecurity. Food insecurity really started to help me understand and open up my eyes about how I could use food and nutrition in a much more effective way in meeting members or patients rather where they were with different populations that I was serving, whether Medicaid or commercial insurance. And so, in thinking about food insecurity and engaging it, I started to understand the prevalence was incredibly high. I started to realize that I had my own experiences, and I started to realize that it not only affected disease outcomes of patients, but it also affected how they engage with food, right? So food insecurity, it sort of affected the stresses of families and they started to gravitate towards foods that are more ultra processed and more convenient and lower nutritional value, higher in caloric density. There were all these challenges that they were having around picking foods. And also food means so much to people. It's not only health, food is social, food is pleasing, food is family, food is joy. Food means so much to us. What I started to do as a pediatrician was really lean into the space of advocacy. So, advocacy in a few different fronts. I wanted to help providers and myself screen better to address health related social needs, so food insecurity, nutrition security. And then not only that, but intervene to connect families to meaningful resources that were local, federal resources, resources that would be incredibly helpful to them in their journey towards improving health. But the last thing that I started to advocate around was really using my voice, learning that I had a voice, learning that this voice mattered in different spaces, and hearing the stories and the experiences of my families, and taking those stories to influence big P policy and little p policy within organizations to improve health outcomes, recognizing that these roles were things that I could do as a pediatrician were very important for me and really helped lead me into the steps, into the positions, and the things that I'm doing today.
Well, I think that's a great journey and great explanation for why you are and what you're doing today. And definitely as a pediatrician, I feel like, you can use your voice and be an advocate for all of your patients. So I think that's a really great and enlightening journey that you're embarking on. And I'm glad you get to do something that you are really interested in within nutrition. And also tell me more about your food as medicine strategy and how this integration will impact healthcare outcomes from a payer perspective.
Great. So as you all know, I work at Elevance Health. For those who don't know, Elevance Health previously was known as Anthem. Elevance Health serves over 47 million members around the country. And one of the things that I think is really important to understand is that being in the food space is not new for Elevance Health. This is not a new thing. For years, we've been doing a lot of work within the food space, within commercial lines of business, Medicaid and Medicare, within our own house account. So we've done a lot of really great work over the years in this space before I even got here. What I will say is about 3 years ago, our foundation was working on a number of different uh, opportunities around the country. And one of the things that they realized is, hey, what would it look like if we streamlined our services to focusing on three main areas? Maternal health, substance
Mhm.
abuse, and food as medicine. So food as medicine became a priority area, and they started committing larger amounts of resources towards that to support communities throughout the country in improving health outcomes. What we saw as a result of that was improved health outcomes. In addition, our own house account, our own employees started to benefit from some of the programs we were offering, which provided medically tailored groceries. We were seeing improvements in ED visits and improvements in health outcomes. And we said, what does it look like to create better alignment across our enterprise? So we created the position of Food as Medicine Program Director and allowed for better alignment to be created overall. Our strategy has been an effort that we've spent a lot of time really focusing on, and I would love to share some of that with you all today. When we think about our strategy, there are a few different elements that we think about. We have three pillars that we focus on. Focus number one is how do we implement food as medicine as part of our health strategy within our whole health paradigm. You
Mhm.
might have heard about whole health before, but the way we think about whole health is we recognize that the health of our members around the country and patients, has a lot more to do with what happens outside of the four walls of the clinical spaces than within the four walls of the clinical spaces. I hate to say that as a pediatrician, but the reality is it's true. So much happens outside of those four walls. Food insecurity, nutrition insecurity, housing, transportation, all these factors are huge. And we heavily lead into these concepts when we create solutions for families, recognizing that we have to uniquely understand these experiences and then be able to respond in a unique fashion as well to be able to meet members where they are, no matter where they
Mhm.
are. So that's important for us. So the first thing we want to do is implement a food as medicine health strategy within our whole health strategy, right? So we think about this through every line of business: commercial, Medicaid, Medicare, our house account within for our own employees. How can we think about food as medicine to fit within this whole picture? It's going to look a little different, but that's an important aspect for us to create better alignment. Number two, we really focus on advancing a digital first approach to food access and education. So we recognize the role of great solutions that lean into digital first solutions, right? And we want to make sure we're building this around food access so all of our members can access high quality foods no matter where they are so that they can live an active and healthy lifestyle. In addition to high quality education as well. This is really important for us and we are using digital first approaches to do this. And last but not least, number three, what we're trying to do is advocate. We want to advocate to improve health systems and to really build awareness for the role that food plays with health. We want to
Mhm.
bring these worlds together, advocate for these things. So you'll find us in many different circles. One, we really want to prioritize thought leadership, right? Leading in the ways that we're talking about this and moving forward data and talking about this in many different forms and fashions. We want to make sure that you see that we're working with a lot of our community partners on the ground who've been doing this work for years that we value and cherish in this work that we're doing.
Mhm.
And last but not least, we want to support public advocacy and public policy that move this work forward. Some of the public policy that we even think about is even thinking about things like the medical loss ratio. We want to recognize that how can social drivers of health not be viewed as an administrative service, but rather a
Mhm.
medical expense? We recognize that when CMS and federal government put some clarity around some of these initiatives, it only allows organizations like ours to scale up these initiatives. We're going to do them anyway, but it allows us to do it even better. And so we look forward to that as well. So those are our three pillars. And on top of our pillars, we're using a number of different approaches from medically tailored meals to medically tailored groceries or medically supportive meals and groceries to produce prescriptions to federal nutrition programs, aligning well with those, recognizing that they're effective, they're evidence based, they
Mhm.
improve health outcomes from population community level healthy food policies and programs. Again, policies and organizations, the communities that are doing great work as is. And last but not least, we want to support personalized and empathetic nutrition counseling and education, meeting members where they are, tailoring education for their needs, to support them in improving their health outcomes. These are some of the areas that we are focused on and we're really prioritizing through our food as medicine health strategy.
Yeah, I think you really, really well defined that how food is medicine is a strategy in everything that you just said. And in talking about how it's evidence-based, how do you measure the success of the food as medicine interventions and what metrics or outcomes are prioritized when you're evaluating their effectiveness?
Whew, thank you for asking that question. I don't think we can ask that enough. I think we have to not forget about that. We've gained and garnered a ton of momentum in this food as medicine space over these past few years. And it's going to be so important that we're able to continue to show how these programs are improving outcomes in a variety of different ways. There's some basic questions that we still ask, right? So, what's the right dose for food as medicine? How much food do we need to give? For how long? For what is the best medication or right foods? What foods should we be using for certain conditions? How long should we be using them? Should we be combining initiatives? There's still questions that we have, but we also know there's a lot that we already know. We know the effect of food on disease outcomes. We know the effect on education on disease outcomes. We know when we bring these two worlds together, there's a synergistic effect that we can see. We are not waiting for all the questions to be answered before we lean into this space, because at Elevance Health, we truly believe in the power of food as medicine and want to give it the chance it deserves. So, how do we measure these things well? There are a few
Mhm.
ways that we would think about. First and foremost, when you think about outcomes, we want to think about the health outcomes of individuals. What's happening with diabetes and high blood pressure and maternal health outcomes and all these conditions? Our A1C is improving, our blood pressure is improving. What about maternal health outcomes, birth outcomes, right? What about overall mental health status? We also want to think about health related social needs. What about food and nutrition security? How well are those being improved as a result of these interventions? We know that these can be improved. How well are they being improved? We also want to think about cost of care. We see the skyrocketing rates of healthcare over the years. The Rockefeller Foundation and Tufts University did an analysis a few years ago looking at the cost of diet related chronic conditions and food security on our healthcare system. And they tabulated that it costs us over $1 trillion annually. So we know that costs are going up. Can food be used as a way to curb costs? Let's think
Mhm.
about it. ER visits, reducing ER visits, reducing hospitalization or readmissions to the hospital due to malnutrition and other concerns. We want to think about medication adherence. Some meds are going to be critically important for improving health outcomes. Can we use food as a tool to improve medication adherence? What about hospital or clinic visits, primary care, and specialty visits? These are all the ways that we want to think about as well. There are a few other areas that I would highlight. One of them being using food as an engagement tool. Can food be used as a tool to improve connectivity with patients and families? This is an important way that we can measure and see as well. And last but not least, we don't talk enough about this, but we want to understand the qualitative feedback about these interventions as well.
Mhm.
Qualitative research has always been important to me and the work that we've done. And how we think about that, we want to ask members directly, how has this been beneficial for you? And how can we improve upon these experiences for what you are experiencing on a day to day basis? Are foods tasty? Are they convenient? Are they effective in helping you reach your outcomes? Do you enjoy them? Are you eating these foods? These kind of things are important as well and are important outcomes that we want to look at. And I should also mention other satisfaction metrics as well. HEDIS scores, quality metrics through CAPS and STARS. These are a variety of different tools that we want to use to understand the effectiveness of food as medicine within the spaces that we sit.
Yeah. I gotta say, after hearing all about this, I never thought about food as medicine in this way before. So I think you've really opened my mind, and I'm sure a lot of our audience here today as well, about how food really can be used as a medicine. It can, like you said, perhaps eliminate ER visits, eliminate, just general healthcare concerns. So this is a really enlightening conversation because I've never really thought about this before. And I know we're close to time, so I wanted to ask you just one more question here. Can you provide a specific example or case study even where food as medicine strategies have made a significant impact on health outcomes?
Yeah, yeah. And I want to highlight that, ED visits overall are not going to change with only food, right? We're talking
Mhm.
about diet sensitive conditions. We're talking about the role of these conditions and how they correlate with food and nutrition security. These are ways in which it can improve. Some of the ways that we have used food as medicine within our enterprise and have seen significant outcomes. I mentioned some of them earlier, but let me be a little bit more specific. one of the groups that we've worked with. So our foundation has committed $30 million over a 3-year period to supporting authentic food as medicine solutions around the country. One of the interventions that we supported is a partnership with Feeding America. For those who don't know, Feeding America is one of the largest umbrella organizations encompassing the majority of food banks around the country. These food banks have done a phenomenal job in engaging with populations far and wide. So what we've seen is that these food banks and the support that we provided to Feeding America, what they've done is partner with a number of food banks, which have partnered with local health systems. And they've created what we call food pharmacies that are patient and member facing, not just our members, but patients around the country or individuals around the country who are experiencing chronic conditions or who are experiencing food and nutrition security. And we've seen that as a result of these interventions, these powerful collaboratives, we've seen that plenty of positive health outcomes have resulted in these as well. And we look forward to sharing more of these in the coming months. But I do want to highlight that that's one of the ways in which we've seen some positive successes from food as medicine interventions.
Thank you so much for joining us today. Seriously, I have such an enlightening conversation that I've never even thought about how food could be used as medicine before this. So I just want to thank you so much for taking time out of your busy schedule to talk with us about your passion and all the great work that you're doing for your community and for all of your patients. Thank you so much again for joining us today.
Thank you for having us. We really appreciate it.
And if you want to check out more, we'll definitely have all of the LinkedIn information in the chat. Thank you again. Hope you have a great rest of your day.